how fast would you do it? Like, for example, when someone, starts using the product, the HMD, like, would they maybe start feeling the difference, because you've used it, like, would you feel the difference within a month or faster? Like,
no, usually it's very much faster. The change is, the difference is, well, you gotta understand that although the biologicals, the biologicals as a therapeutic measures, right? They are in principle absolutely different from the pharmaceuticals. The pharmaceuticals act now, they have half-life, they have a limited period of action, duration of action, after which the effect wears off, then you have to redose.
Yeah. The
biologicals, there are some similarities, but the biologicals act differently. They change, they sort of normalize, optimize you from the core of that condition.
So it might take a little bit longer, but it's more lasting.
It's definitely more lasting. It's definitely quite often more sustainable, more natural, if you want to use that word. Quite often safer.
Oh, that's a very strong plus point.
Yeah, quite often safer. But please don't forget that after all, it's all chemistry and it's all biochemistry. Whether it's a naturally occurring compound that you procure from a living being, a herbal or xenogenic source of it, okay, as long as it is procured and prepared properly with all the high standards, okay, the product itself has got high standards of the source from where it is procured, okay, there's so much differences in the GMO and the non-GMO plants.
Oh yeah,
definitely. Okay. If we talk about the xenogenic products, there's such a huge difference if the xenogenic product is prepared as the pharmaceutical grade. Okay. So supplements, any form of supplement, can be made higher standards, pharma grade, class A, whatever you call it, or more like a warehouse, kitchen, backyard, which also happens.
Yes.
It happens.
Because when there's a demand, there's a supply, right? So
of course.
Yeah.
Of course.
But just remember, if you're getting your supply, just make sure you get it from a proper source.
So the source and the manufacturing, the whole chain of manufacturing, and then of course logistics, delivery, storage, because some products have to be refrigerated, some have to be frozen. Well, there's so many nuances, So as long as you have a legitimate, reputable and responsible vendor who is procuring, manufacturing and delivering goods to you, well, chances that you're going to benefit from that and going to be safe are much, much higher than something
that you procure from the back streets.
God knows from where, yeah.
Got it. So moving on to the next point, where I believe one of your passion is also, in this thing called hormonal optimization, and I think that what has come out in our discussion as well, because aging is also, of course, primarily due to hormonal decline, right?
Right.
Yeah.
It's indivisible, right? It definitely, you cannot just extract that part from the well-being and just solely focus on that. However, there's so many practitioners and there's so many doctors also who only do this, only do the hormone optimization or the hormonal replacement. It's sort of like you're gonna be a one-armed person,
Okay.
Okay.
All right.
It's but on the other hand, there's so many practitioners who neglect the hormonal profile, tremendously.
Okay.
And thing is, this topic requires more attention than it has now. Okay, a lot of misunderstanding, a lot of taboos in medicine, a lot of stigma around it, and a lot of it's a very underrated topic. Even in my opinion, even the approach towards managing the hormonal balance is out there is not really ideal. And I explain to you why. Because of mostly two reasons. Reason number one, practitioners and patients, just general public, more rely on the results, on the numbers in their blood test. Okay? They neglect the clinical part of it. The actual signs and symptoms of the hypogonadism or signs and symptoms of reduced hormonal decline in any other hormonal production.
What is testosterone, progesterone?
Well,
estrogen?
those are sex hormones, right? But there's also the thyroid hormones, right? There's also neurohormones, neurosteroids, okay, or neuromediators. This also is a growth hormone. You know, there's so many aspects of it that are either not well understood or addressed. They're sort of considered to be a very narrow specialty. Like, okay, let the endocrinologists say deal with that, you know, but the endocrinologists will deal with the disease. Okay, the endocrinologists will not deal with the wellness and aging aspect of
Like
it.
if you have a problem with thyroid, we'll give you a specific thing to stimulate.
Right. We'll give you a specific medication, which is thyroid replacement therapy, and that too if you have been diagnosed with a specific disease, or you went through the surgery, a full removal of the thyroid gland, and now you have just to supplement this hormone lifelong. So those subtle changes or the subtle decline very, very often, in most of the cases, is left unaddressed. It is the most pronounced when it's coming to the sex hormones.
Yes, because you can see it very obvious.
Because it's so obvious, and yet it is underrated, yet it is not addressed and approached properly.
Oh dear.
Yet it is very, very much misunderstood. Even, we'll keep on coming back to this topic, depression. A male depression, or in female the climacteric depression, you know, that very often is treated by a totally irrelevant medications, maybe some antidepressants, you know, when you can fix that by optimizing the hormonal profile.
Which is better, right? Because then you don't have the side effects of all these.
It's better. It's better from all points of view. Okay, because you're gonna improve other aspects like the sexual life, like the ability to regain or preserve your lean muscle mass. It's the metabolism of and the fate of the adipose tissue. Yeah, no matter what you do, if you have a hormonal decline, you'll be more prone to excessive amount of the fat tissue deposition. You're gonna be losing your muscle. You're gonna lose your cells. Gonna lose the sensitivity to insulin. That's just for the beginning. You know, that's just for the start. Okay. In the long run, it's a bone tissue, the ligaments, the joints deteriorate as well. You know, so that's on one hand. On the other hand, the second problem that comes along with this, inadequate measures. Inadequate measures.
Okay. What do you mean by that?
What I mean by that? Stuff like testosterone boosters, stuff like hormonal boosters,
Okay.
To a certain extent bioidenticals and all of that, you know, which I'm very, very skeptical of. Okay, I'm very, very skeptical of. So when it's coming to this topic, I always go back to the position of conventional medical science. Okay, and it's one of the reasons. It's one of the topics that we teach in the academy. By the way, what is the actual evidence behind the hormonal optimization, and what are the different pathways of the hormonal optimization, depending on many reasons, either age or sort of the needs of the person, and even the readiness and the acceptance of the person, whether they're open towards different treatment methodologies or not. You know, so some people, they still have that stigma. Some people think that, oh, maybe I will not go for the hormone replacement therapy. Well, maybe yet. Not yet. Maybe you will not go, right? Okay, but there's also these other ways, better than use of so-called testosterone boosters and all, which practice shows that they don't work.
Okay.
Most of them do not work. Most of them.
Even though for a short run.
Very, very minimal, not really significant effect. And I've observed that. It's not only I get the theoretical data, you know, but I've observed that.
People who use it and all of that. Okay.
Huge amount of cases. Okay. Various in different countries, in different, whether it's from the Ayurvedic medicine or the TCM, you know, any other, just stuff from the internet, you know, there's so many products that were supposed to, you know, increase this and that. Most of them do not work, and they can't work. It's great, it's just because of the mechanism of action. It's not possible. It's great if they don't cause much harm, but unfortunately, some of it can be counterproductive. You know, there's a number of the so-called testosterone boosters that will just reduce, you know, and not in the long run. You just wait for a few months, yeah. But when you will compare the results with the actual blood work, you know, there won't be any improvement. It'll be less. So, but when it's coming to the hormonal optimization, there are holistic protocols which have a very strong foundation of the science. So as long as it is about the hypothalamus, pituitary, adrenal, gonadal axis, yeah. As long as it's stimulating, you know, like a different layers of this axis properly, as long as it is supported by regular, meticulous blood work, okay? And another very important thing that it's also a very multi-dimensional, multifactorial approach, you know, and as the time progresses, the regimen will change a bit, simply because the person is changing as well. You know, one of the examples that I can give you is that the more subcutaneous fat tissue a male person has, the faster they will aromatize, convert their testosterone to estrogen, or to a larger extent. Yeah, because that aromatization, the process is happening in the fat tissue. So when you trigger the reduction of the subcutaneous fat and the leaner person becomes, the ratio or the rate, that speed of conversion of the testosterone aromatization into estrogen will also reduce.
Is that the reason why, like, I see sometimes some like obese men, you know, tend to have like what we call as man boobs, like moobs, because you know.
Partially it's because it's just fat. Yeah, partially because fat, but partially because the ratios between different hormones, specifically the ratio between the testosterone and the estradiol, is off.
Yeah.
Okay?
Okay.
Very common mistake, by the general, which is made by the general public, by the recipients, by patients, clients, and also by the healthcare practitioners, doctors, and whatsoever, is that they tend to rely on the blood investigations, and they look at the actual result and just compare that to the normal range without actually looking at the ratios of the hormones.
Oh.
Yeah, that is very important, and the studies show that the testosterone to estrogen ratio may be more predictive and more valuable as the parameter. It will carry more information, be more accurate even, rather than just looking at the total testosterone level, you know, which is the total estrogen level. They may appear they're within the normal range both, but when the ratio is off, many things will be off. The libido will not be there, definitely. The cardiovascular health, the heart health will not be there. The fat, lipid metabolism, you know, the HDL, LDL, you know, that the biochemical mechanisms will be off, you know. Bring that to the normal range, normal ratio, it's doable, and you have higher chances of improving the well-being of the person. Okay? And those things, there are sort of symptoms or signs which are very obvious, and they're immediate, right? But there's also a very long-term consequences of that, like the bone health, the bone mineralization. Okay, your prostate health.
Which is very common with males.
It's very, very important, and it is not just on the testosterone level or just the DHT level, you know, the dihydrotestosterone and all. It also very much depends on that balance, you know, between the estrogen, the DHT, the testosterone and all. So as long as it has been understood properly and meticulously checked, diagnosed, first you have to understand how it works, have the knowledge, have the experience, then diagnose it. The diagnosis has to be adequate and profound enough. So hence you touch the topic of the hormonal balance. It is definitely not enough just to know the total testosterone level. You know, to me as a doctor, I'm really the, you know, genuine answer to anyone, you know, a genuine question to anyone out there is like, if you just have only the total testosterone level, you know, if you've done your blood investigation, you've done your blood work, and you just have the total testosterone level, and whatever, say, number it is, yeah, if say nanomolar per liter, say it's 40. What sort of information does it give you? Frankly speaking, none.
Yeah.
None. What sort of, is it high, is it low, is it enough? Even if you will correlate that with the age? No. No. You need to know clinical presentation. Yeah, there are markers for that. And you need to know other hormones, such as you need to calculate the free testosterone. To calculate the free testosterone, you need to know the values of the sex hormone binding globulin. You need to know the amount of the serum albumin, because the testosterone does not just freely float in our body. The majority of it, like 98%, 97, 98%, is bound to different proteins. Some of them have a very tight bond, which is with the SHBG, the sex hormone binding globulin. Some have very loose bonds with albumin, so the albumin is ready to give it away as a bioavailable molecule. Okay, but I tell you more. This again, the deeper you go, the more misconceptions we encounter.
Yeah.
There's so many practitioners out there. They say, "Ooh, high SHBG, just a high sex hormone binding globulin. Just reduce that by whatever means. Gonna make it better." That's also a very superficial point of view, because SHBG it's something as a buffer. It's a carrier of the reserves of the testosterone that you have. So just trying to increase the free testosterone by suppressing and reducing the SHBG. It's like you have a basement, kind of a cellar that you keep your rice for the off season.
Okay.
For some reserves, for the rainy day, when it's really tight and you don't have a single penny in your pocket to buy rice. So it's like it's depleting all those reserves.
Wow.
And once you deplete the reserve completely, once you have depleted it, what are you left with?
Correct.
So a lot of misconceptions, a lot of miseducation or maleducation, also of the doctors and all in this term, and a lot of taboos.
Yeah.
So we are trying to get out of that vicious cycle. We're trying to break that, and the only way, which we believe in European wellness, the whole group, is the education and awareness.
Correct. When people know what it is, they can ask the right questions to the practitioners, and they go like, "Wait a minute, why are you doing this? I heard it was like that." And then again, it starts the dialogue, right? And then people start
and bring the evidence.
Yeah.
Always bring the evidence.
Correct. And making conscious, well-informed decisions, which I think what every consumer wants, especially the viewers as well. You want to be well-informed so that you know your options, you know your choices, you know what to ask, how to ask, and you also know if someone is, not, just recommending it for the sake of recommending it. Because remember, at the end of the day, it's your body. You need to know what's happening to it, and take full charge over it as well. You can't just hand your body over to someone and say.
And very important with when it's coming to hormonal optimization, very, very important is not to overdo it.
Yeah.
Okay, because sometimes it's not just a linear shape of association between an endeavor, treatment, and the outcome. It can be a U-shape, right? It's bad when too little, it's equally horrible when there's too much, right? It has to be the quantum satis in Latin, quantum satis means sufficient amount.
Equilibrium.
Yes.
Sweet spot.
Sweet spot. Absolutely right.
Yeah.
The sweet spot. the sweet spot. And in this topic also, by the way, we have we've done some work and we have some publications, in some paradigms and
Nice.
on that we have developed ourselves, and it's not always hormone replacement therapy. The HRT is, of course, it has its own room for specific cases and all. Treat that with absolute respect. However, there are also other treatment modalities. Again, the stimulation, when you address the hypothalamus, pituitary, adrenal gonadal axis properly, and in European wellness we have sort of some of them are even non-invasive, totally extracorporeal methods of like the bio-hormonal, the device that has that stimulation of the pituitary gland. And when you combine that with a proper designed and researched supplementation or the stimulation with protohormones, with the precursors, that's how you can increase that hormonal level, optimize it within the physiological range. Okay, less risks or less chances of the overdose when you go towards the supraphysiological level. Okay, so
Nice.
there are options. The great thing is that there are always different options, and something that can be offered to the client, and they can do their own research. I always encourage people, go and get the second opinion.
Oh, definitely. Yeah.
Go get the second opinion, go get the third opinion. Okay? And I always say, if a person who gives you a second opinion wants to discuss something with me or with anyone from our group,
Please do.
please do, always more than welcome. Because I want to learn myself,
Correct.
I want to learn myself. That's what I'm doing all the time, and in all the courses.
Yeah. And I
Even
think,
today, by the way, I'm going to attend one of the online courses that are going to last for a few weeks.
oh, nice.
So it's never ending.
No.
You never old to learn.
We call it lifelong learning.
Yeah, lifelong.
Yeah. Regardless of whatever profession you're in, as long as you're willing to put in the hours, keep abreast with what's going on, and dialogue it, and of course do intellectual reflection over what you've learned, because you can't just take everything, and like the gospel truth, there has to be some pinch of salt. Then you do comparative study, you cross-reference it with other materials, and then you come up with your own informed decision before you then talk to someone about it, right?
Correct.
Yeah. Amazing.
By the way, another very good method of learning is teaching.
Oh yes.
Yeah, when you teach somebody, you are rehearsing it.
Yeah.
You are systematizing, you are settling down the information in your brain, you try to characterize that better, put that in the specific blocks and easier to deliver.